Welcome back to my channel. This is my first ever attempt at a study vlog. On this specific day, I woke up at 9 a.m. to do some revision, and as you can see here, I'm just scrolling through some anatomy notes just to figure out what's important to know. I'm just going through the hardest things which I feel like I don't really remember. So I'm labeling some structures here which I feel like I've forgotten. They're called the sutures on the head, so we need to know the names for them. If you want to know more specifically what I'm doing, I'm basically going through different pictures and annotations and trying to label the structures without actually looking at the answers. So I'm trying to force my memory to actually just remember. And you probably have done this in A-level: frontal, temporal, parietal, and occipital, these bones. You've probably done that in A-level already. But what we learned, which was new in first year, was that there's a specific point on the brain called the tyrion, and that's where if there's an immediate blow by a sharp object or something like that, then that can actually cause an intracranial bleed. So that's an interesting fact if you'd like to know. So that's usually what I do for anatomy, just go through the different diagrams and annotations and just make sure if I don't know something, then I rub it out and make a mark of it, so then next time when I go through it again, I can redo that specific word which I've forgotten. So that's a small short demo. If you're interested in finding out what exams I have this year and what my schedule looks like, so I have one exam on the 4th, one exam on the 7th, and then I have one exam on the 12th. So basically I have 3 big exams this year. My first exam is a physiology exam, and then my second exam is an anatomy exam. And in the anatomy exam, what we actually have, it's basically they give us lots of pictures of different real life images of cadavers, and then we have to identify the structures, the vessels, the nerves, sometimes the clinical relevance of what the structures actually are. And then after that, we basically have a biochemistry exam as well. If you'd like to know what my schedule actually looked like before, so this is my schedule in February, and that's how it basically looked like. It was completely packed, and as you can see, there was a lot of stuff to do every single day. We had a lot of lectures and tutorials and classes and things. Every first Thursday, what we had to do was go to Charing Cross Hospital and have anatomy sessions there. So basically dissection sessions where we get to see real life specimens and cadavers and learn and really apply the anatomy that we've learned to real life. And then every second Thursday, what we had to do was go to a GP clinic, and we had these allocated to us, and then we had to sit in patient clinics, observe how the GP's talking to the patients. We also did actually have home visits as well, so that was pretty exciting. Then if you'd like to know what my timetable actually looked like back during October time, that was basically also very, very similar to this. It was very packed in the same way, and we had a lot of things going on, a mixture of labs, tutorials, lectures, and classes. So within physiology, these are the different chapters that we have, things like cardiology, endocrinology, gastroenterology, those sorts of things. Today I feel like I'm going to focus more on gastroenterology because that's one of my weaknesses, and I'm going to go through a few lectures from there. I'm going to start off by learning about the pancreas, and then I'm going to actually move on to learning about the liver. I've actually gone over these things before, but I'm just going through it again just to check if I've remembered it. So if you kind of want to know how I revise these PowerPoints and things, I basically have like a Word document with all the different subtopics in it and chapters, and then I make a list of the lecture questions. So I make questions for like the slides. So if it's like let's say it's like what is the structure of the stomach, and draw it, and then I answer these questions, and whichever questions I get wrong, I highlight them in red. Now what I'm doing is covering up the lecture slide and drawing a diagram of the liver from memory and trying to remember what I've actually labeled in the PowerPoint. I'm trying to answer some of the questions as well whilst I'm doing that. So some of the lecture questions which I've written for myself, I'm trying to go through those. Then I'm checking and marking the the annotations, if they're right or not, and trying to understand what I've actually missed. Then I'm going through the other questions and the other slides, and just trying to write down as much as I can remember and answer them, and then looking at the answers, and I'm just going through it really. Fast forward about 2 hours, I am done with that specific lecture, and I've answered each question in proper thorough detail, so I don't need to go through this lecture for a long time, and I'm going to give myself enough time to forget it. And I've completely finished that lecture. So these are basically the tutorials for the course, for my course, and then here I'm just opening on which is relevant to the lecture. So I'm just gonna go through this tutorial now. So then it's basically like there's questions and stuff, and then you just have to answer them. We've actually gone through this in class, but it was ages ago and I actually don't remember much, so I'm gonna try and answer these questions again from memory. Then I took a quick break and re-energized with a snack. I wanted to end the day off by doing some anatomy revision again, and for that I just made a small to-do list as to what I wanted to cover next. And here I'm just writing my to-do list. And here I decided I wanted to do some head and neck revision, so I took out some of my anatomy flashcards and went through them. This is the contents page. I start off with card number 1. So what I do in these sorts of sessions is basically I read out the numbers to myself and then I look at the answers afterwards. So there's like numbered labels, you just read them out and then pronounce the different words and different labels. Usually the problem with this is that you can't really remember spelling that properly, but it's a very, very quick way to go through the flashcards, because if I do write them down, it does take very long. So I start off with this first. Number 1 is occipital, number 2 is the coronal suture, number 3 is the zygomatic bone, number 6 is the other bone, I don't know which bone that was. Number 5 is the maxilla, and number 7 is number 8 is the lambdoid suture. In the same fashion, I just continue and keep reviewing every flashcard, as many as I can do at my own pace. Since our exam is actually based on not these sorts of images, it's mainly based on the real life images, I actually did use a textbook to look at the real life images. Finally, I got really, really tired of just speaking and talking to myself, so then I just decided that I'm just gonna write the answers down now, and that will help me work on my spelling as well, because sometimes I do mess up my spelling in these sorts of questions. Some things really do spell similar to others. I'm just going through the textbook and referring different sorts of structures back to the real life images, because some things can actually look quite different in the real life cadaver images compared to the flashcards. And now I'm done with my flashcards, and I think I should be okay for today. And now I'm just tidying up my flashcards, putting them in the right order, arranging them again so that I can find them in the same order next time, and putting them back in the box. Thank you for watching today's video, and I hope you enjoyed it. Please like and subscribe and share.